So it won't be so.
All right. Welcome back to Talks with Dr. D. I am Dr. D. This panel of wonderful women are my friends, they're my colleagues, they're my sisters, and some are even my sorority sisters. So you ask, what is this about? Katie Styling is a virtual platform that is all things health, wellness, and beauty for people affected by breast cancer, for caregivers, and those who support us. I am a board certified podiatrist and I beat stage 2 HER2 breast cancer. Woo! And it's been my mantra, it's been my passion to educate and inform you while entertaining you about different topics that pertain to people with breast cancer and the immunocompromised. One of the big things that we're worried about is that ugly word, the Rona, as we hear, coronavirus. People have so many ooh, and now Moderna and Pfizer has come out with a vaccine. Particularly for people of color, we have a history of the Tuskegee experiment and Henrietta Lacks, which makes us go, when we hear it sometimes about vaccinations and clinical trials. So I figured who better to talk about it than myself and my colleagues. So I'm going to introduce each one of them because they have an extensive, beautiful background that makes you go, all right. So the first lovely lady is Dr. Michelle Alexander. She is the CEO of EBON. I think I'm saying that correctly.
EBON.
Thank you. Research Systems. The former medical director of occupational health at Con Ed for many of us who live in the tri-state. Completed her residency at Kings County Downstate Medical Center in internal medicine. Dr. Alexander was the vice president of the occupational health at Metropolitan Transit Authority in New York City and has practiced occupational and environmental health for over 30 years. Among her many interests is avid exercise, and she's a nutritional junkie. I know that for a fact. He has one son who's in his last year of Rochester in mechanical engineering, and she is a member of the illustrious Phi Alpha Kappa Alpha sorority. Welcome, Dr. Michelle Alexander.
Thank you. Thank you very much for inviting me. I'm really excited about being here, and I am humbled to be in the presence of such intelligent, gorgeous women who are going to be able to give us so much information today.
Absolutely. Our next guest is Dr. Monique Gary. A breast oncology surgeon. That's the person who takes you to the operating room to make sure the girls are good. Board certified, trained surgical oncologist, middle sector, Grandview Health and Cancer, Cancer Center in Sellersville, Pennsylvania, where she also serves as a director of breast programs. She completed her PhD at Philadelphia College of Osteopathic Medicine at the University of Massachusetts, her surgical oncology fellowship for University, faculty appointments at the Philadelphia College of Osteopathic Medicine and University, UNT. She serves as the board member for several organizations such as medical director for one of my favorite, the Black Breast Cancer Alliance, and she's a medical advisor for the Tiger Lily Foundation. She is on so many things and in so many places. You can hear her on Daily Check-In with Dr. Mo, on Urban One radio station, and Doctor is in on BlackDoctor.org. My sorority sister of the illustrious Alpha Kappa Alpha Sorority Incorporated, Dr. Monique Gary. Welcome.
Oh, thank you so much for having me here today. It's such an important and timely topic, and I think you've got an amazing group of panelists who are going to really get into it and answer the questions that are on people's minds today. So I'm just honored to be here among such greatness, and I thank you for sharing with me and including me.
Absolutely. The other thing that I want to say is that these women, we're not, some of us were linked, some of us were not, but we're linked today. And my favorite, but not last and definitely not least, is Dr. Ann Maitland. And I want to say before I even introduce her that each of these women have treated me either as a patient, a consult, a friend in some form or fashion. I would never have anyone on my show that I have not vetted. And so I got the question of, why do you have only African Americans? I am African American, and I'm blessed to have a lot of African American friends, but I also have other friends who you'll see as Dr. D progresses through the year. So let me introduce my friend, Dr. Ann Maitland. Dr. Ann Maitland is a fellow of the American College of Asthma and Immunology, okay? And the member of the American Academy of Asthma and Immunology. Her focus is to upgrade efforts to meet the underserved communities plagued by immune-mediated disorders such as mast cell activation, which your girl has, anaphylaxis, asthma, food sensitivities, this is right up my alley, as well as primary immunodeficiencies. She is a former past chair of the Committee for the Underserved. She is a faculty of allergy and immunology for the National Medical Association, and she's a chairperson of the mast cell divisions of the AAI and faculty members for the MCA disorders. Recent publications describe clinical phenotypes in pediatric and adult patients. She has a host of op-eds and it's just absolutely fabulous. Dr. Ann Maitland, we welcome you.
I'm just trying to keep up with this illustrious crew. Let me tell you, I'll ask for honorary soror process.
One day. All righty. So hopefully everyone can hear me. Can you ladies hear me clearly? Wonderful. Okay, let's start. So there's so many fallacies and rumors. My mama said all kind of foolishness that we're hearing. You know what? I'm going to start off with the basics. Let's define what is the coronavirus. Dr. Ann Maitland, can you give us a short brief of what that is?
So it's actually a common family of viruses. Children are impacted by coronavirus quite a bit, but unfortunately, this virus learned a big trick on how to get up into the respiratory passages and just sit there and cause slow damage. And what we see is that these individuals, children are different than adults, first of all, in many, many ways. But for 18 and over, we find that this virus sits up there for about anywhere from 5 to 19 days. So that's why people can be super spreaders, because they really don't feel it until they really feel it. And then what happens is the immune system is trying to do this battle, and 4 out of 5 adults, the battle at the front line isn't working. And so the responding immune system calls in for the mother of all immune responses. And the people that are impacted by COVID, it's not the virus that's actually causing the damage. It's an overactive immune response that's causing the damage. So what we're trying to do is, prevent people from getting infected once they've been exposed, and then also to kind of optimize their immune response, so they shut it down before the SWAT team gets called in. We're trying to bolster the first responder response, and this is what the vaccine is all about.
Thank you so much. And okay, so with that being said, now we have what everybody's talking about, our vaccines. I'm going to punt this to Dr. Michelle Alexander. Michelle, can you tell us what is the what's the word I want to use? What is a vaccine, and why do we need vaccines? Because people seem to be so afraid of the word vaccination, particularly as they said this virus came out too early. So let's talk about that, and you tell me what is the vaccine. And then Dr. Monique Gary, we're going to punt it to you. We can talk a little bit about Moderna and Pfizer after. Michelle? You're on mute, my love. Come off mute.
Yes. Okay, so I forgot again. So I guess everybody knows that vaccines have been popular in use for many years. The polio vaccine is one of the vaccines that everybody gets, and we've used for now probably close to, I guess it is more than 60 years. And it is a safe vaccine which has eradicated polio in the entire world. So giving the vaccine, what it does is it causes the body's immune system to respond to an infective agent. That infective agent causes the body to produce cells in response to that will kill the virus when it's the virus or the bacteria in this case, that it will kill the virus prior to it causing a severe infection. And the appropriate immune response will allow the body to fight it off soon and therefore prevent you from getting the active disease. So as a result, there are many, we have, so for children, you have the measles, the mumps, and diphtheria vaccines. This causes the body to respond appropriately and fight off those infections. And so people don't get sick as a result. So the whole purpose of a vaccine is to prevent you from getting ill prior to the, and to provide you an immune response prior to being in contact with the actual infective agent. So that's it I guess in a nutshell. And we have 2 new vaccines that have been approved, and Monique is going to talk about it, I guess. But they are very new in terms of the type of vaccines that have been produced. They are mRNA vaccines, and they have a very specific way that they are going to be behaving as opposed to some of the previous vaccines that were made. Previous vaccines that were made from attenuated viruses, meaning that they kill the virus and you're responding to the dead virus and your immune system is responding to that dead virus. Now, the mRNA virus vaccine is much different from that. And it does not contain any of the live or attenuated virus in it.
Okay, thank you. And Dr. Gary, we are going to come on to you. Hold on. Let me just click on this. I want you to tell us, talk about Moderna and talk about Pfizer. Before you start, my lovely colleagues, who got vaccinated, raise your hand. And if you did Moderna, raise your hand. If you did Pfizer, raise your hand. All righty. So you see what the stats are that 3 of us took the vaccine. We can talk about that more. And you're going to hear about some more about the offerings between Moderna and Pfizer, realizing, people, that you don't have a choice of which one you get. It's pretty much going to be what the facility offers. But Dr. Gary is going to go into that. Dr. Gary?
Oh, thank you so much. I think it's important for us to talk a little bit, as our other guest, Dr. Alexander mentioned, about how these vaccines work. So the messenger RNA vaccines, and this is a common myth people have been spreading, that the COVID vaccines are going to get into your DNA and genetically alter your DNA. But the mRNA vaccines do not use the live virus, and they never enter the nucleus of the cell, which is where the DNA is housed. It'd be like going to the kitchen of the house, the main room of the house where all the magic happens. And so the mRNA vaccines do not enter the nucleus. And that's a really important point. I think when we talk about the differences, so we know some of the similarities, that the vaccine has a 95% efficacy in Pfizer and 94.4% in Moderna. And so those are really great numbers. They are both mRNA vaccines, and they both require 2 separate injections, but there are some differences between the 2 in the way they're stored, and how often they're administered. So the Pfizer vaccine has to be shipped at less than -94 degrees Fahrenheit. It has to be stored at that temperature. And once you thaw it, you've got 30 minutes to use it. Between 30 minutes and 2 hours to use that vaccine. So they can be placed in the refrigerator for up to 5 days, but then once it's really at room temperature, they have to use it right away. The Moderna vaccine can be maintained at -4 degrees. And so this makes shipping and distribution probably a little bit easier, especially in certain climates. But the vaccine can stay refrigerated for 30 days and must be used within 12 hours. And how they're diluted. So the Pfizer BioNTech vaccine has to be diluted with saline or salt water. So it comes concentrated and they dilute it in salt water, whereas the Moderna vaccine is ready to be administered. Other key differences when we talk about Pfizer versus Moderna in the trials and the indications. Pfizer is indicated for people who are younger, 16 and older. Moderna 18 and older. And then side effects. This is an important thing to talk about. The side effect profiles of both of these vaccines are fairly similar, which can include tenderness at the site. We can see some headaches, muscle aches and pains, some achy joints as well. And there is really a rare incidence for both of these of severe adverse reactions. So when we say severe adverse reactions, maybe about, I think, more than 5 million vaccines were administered and less than 5,000 adverse events. And of those, less than 21 cases who had really severe issues with it. So I think the safety is demonstrated. There are some really key similarities and only a few differences.
Thank you. So I want to talking about allergies now, because everybody's like, oh Lord, we're gonna fall out and die. I've heard craziness. Michelle, you wanted to make a comment? Absolutely, go for it.
Yeah, so I was going to just say that there is, as I don't want to leave this topic without discussing some surrounding this. We don't want to ignore that the fact that within our community, we have had experiences that make people appropriately concerned about what medicines can do. We know, we can talk about the Tuskegee experiment, the syphilis experiment, which it really was. And we could talk about the fact that smallpox blankets were actually delivered to Native Americans. We can go, in untold ways about what happens in terms of the healthcare community for Black people. And I think it's key that we talk about that and not ignore that there is some real concerns about what this means to our community. So one of the things I did want to say is that my concern is when it comes to the Pfizer vaccine, the vaccine was studied in a very low percentage of Black people. It was 4% or less, I believe, was the total number in terms of the study. And listening to and reading a lot of the information, I would have preferred, prior to making this emergency use authorization, which really eliminates the close study that was done in a clinical trial, I would have preferred extending the study so that large numbers of Black people who have much different outcomes, as we know, when it comes to certain medications, that study included more people that look like us. And without that, because what we know so far is what we know so far. And the most time that I think that we can say at this point, I think it's still under 90 days in terms of the actual effects. And sometimes we know it takes a while before you see effects. And I do want to make sure that it is clear that we're still at the experimental stage of this vaccine. So I think that it's just important that we be totally transparent when we're talking about this.
Sounds great. I agree. Let's talk about allergies to medications. And anyone who knows me personally knows I have allergies, and I have been blessed to have my good friend, Dr. Ann Maitland, keep me on point. And she came up with a protocol for me. Again, my doctor, not your doctor, came up with a protocol for me where I took Zyrtec, I took Singulair, and I took Pepsid. That does not mean go out and take that. That is a disclaimer out there. That is what my doctor gave moi. And I did fabulous with it. I was quite nervous. I got my first vaccination last Tuesday. 15 minutes after, I took a Tylenol. My other good friend in medicine, Dr. Charlize Pont, sat with me in the doctor's lounge and we chit-chat for 30 minutes. And I was quite fine. I'm doing fine. I had soreness at the site. My jaw was a little sore too. On the left side, I have no idea why. And that lasted for like overnight.
Which arm did you get the shot in?
Left side. So yeah. But that was my side effect. So Dr. Maitland, talk to us about patients who are concerned about side effects and who really should be concerned about side effects. Is it the asthmatics? cancer patients, patients with a history of an allergy to the vaccination, patients with histories of allergies in general, not just that you sneeze to maybe a little bit of pollen, but who truly should be concerned, because that is the information that has been all over the place and probably 99.9% wrong.
Well, if you allow me first, I'd like to just piggyback a little bit on Dr. Alexander's comments.
Absolutely.
One, we find that African Americans are at increased risk for getting exposed to the virus, just because of the areas that we work. Look at what happened in the White House when POTUS got infected, and who's working in the White House and we're forced not to wear masks. You know, we're put in situations where we're at great risk for getting exposure, and then we're at greater risk for not having enough access to care if we do get exposed, and to get appropriately treated. And so I appreciate the concerns regarding African Americans and underrepresented minorities participating in clinical trials. But unfortunately, when it comes to participating in clinical trials, again, African Americans are also underrepresented. So there's a lot of trust that needs to be addressed, or lack of trust, between the healthcare community and communities of color. And that's why I'm so excited that you put this forum together, because this is yet another set of faces that hopefully people can trust to say, we're going to give you the best information that we know available. And so when the pandemic first started to hit our shores, the concern was that individuals that had allergies, asthma, history of anaphylaxis, were at a greater risk for developing COVID. And up to this point in time, that has not borne out. Most of the data from the European allergy societies, as well as the societies on these shores, point that if you have asthma or allergic rhinitis, you are not at increased risk for getting developing COVID. And I really would like to emphasize that, but you should still continue practicing protective wears, social distancing, and even with the vaccination, it doesn't necessarily kill the virus. So we all still need to practice social distancing, as well as wear protective equipment when outside of our homes. That being said, there have been a few cases with both vaccines that have been reported that cause anaphylaxis, and we're still trying to get more data on what individuals are predisposed. So out of the cases that have been reported, 2 people do have a history of food allergies, as well as eczema, but there was one patient, actually a nurse in Washington State, that did not have a history of reactions. That being said, I'm recommending that whether you have a history or not, and here's the thing, in this country, asthma is underdiagnosed. Rhinitis is not well controlled. All of these disorders are not well diagnosed and not well managed. So I would emphasize that if you're going for the vaccine, you have a conversation with your primary care physician, or if you're aligned with or you have an allergy immunology specialist on your medical team, in your medical home, it would be important to consult with them. That being said, I do recommend the following for anybody who has a history of just spring allergies, you've been treated for food anaphylaxis, and this is the frightening statistics. 1 out of 50 in this country have been treated for anaphylaxis, as far as the data comes out of 2014. And many more are carrying epinephrine autoinjectors. So I err on the side of caution that a plan should be in place before you get the vaccine. And then once you've decided on a protocol to reduce the susceptibility to reactions, it's important that you stay in a monitored setting for at least 30 minutes after you get the vaccine. And with that, we have seen, and these are the recommendations that come from the American Academy, as well as the American College of Allergies, Asthma, and Immunology. And with that, we've been able to see people tolerate it. Dr. D, just like you, I have allergies, and I went in taking 2 histamine blockers as well as Singulair, and then I have a tendency to also integrate supplements, which are also been known to balance your immune system. And that's what we're talking about. The purpose of this vaccine is not to kind of suppress. It's to basically rehabilitate your defenses so that it uses its energy appropriately to knock out that virus before it gets a foothold. Because once it gets a foothold, it's much more difficult to try to control. And it is really, really important to understand that the only way that we're going to stop this pandemic that is claiming a life every 30 seconds in this country is to get immunized.
Absolutely.
There's nothing else that we have available other than continuing the type of life that we're living. And you can see among this political turmoil, there's some people who are putting others at risk and are not being a good Samaritan and being a neighbor to even their own family members or members in their community.
Absolutely. So, of course, this is a breast cancer talk. So I'm going to punt this now to Monique Gary. Monique, I want to ask the questions. I'm going to ask Dr. Alexander and Dr. Maitland after about these things. So first, what are the risks for cancer patients? That's your question. Dr. Maitland, what are the risks for patients who have sickle cell and other autoimmune disorders? And Michelle, what are the risks that you see with patients with hypertension and diabetes? Let's keep these comments a little concise. And Dr. Gary, you're up.
All right. I think it's a really important topic. And Dr. Ant said something that it resonated with me because I had not heard it that way before, which is that these vaccines are not designed to suppress your immune system. They're designed to boost your immune system. And as people look for ways to try to boost their immune systems, I can think of few patient populations who desire more than cancer patients, because so much of what we do damages temporarily and knocks down and challenges the immune system. So for cancer patients, we know that the coronavirus is more likely, twice as likely to be fatal for these people if they do contract it. And so while they are not yet recommended for the virus, they are, I think, approaching the higher tier. We have had some bodies of governing bodies of physicians and consensus statements that were developed, particularly by the American Association for Cancer Research, that has evaluated, and also the American Cancer Society, whether or not cancer patients should be priority for the vaccine. And what the recommendation is essentially is that it's for patients who are not undergoing active immune suppressing therapy. By that, I mean certain monoclonal antibodies. I mean chemotherapy, which targets all of the fastest growing cells, including the white blood cells. And really, those are the main indications, I think, for which people should not receive the vaccine, because radiation therapy is targeted therapy, although it does cause some damage to cells. Surgery as well is not an immune suppressing event beyond really the 2-week period. And so no one who's in that perioperative period should be getting a vaccine either. But the risks are that the immune response would not be mounted. And this, too, is really kind of counterintuitive, because people think, oh, they're going to get sick, they're going to get the virus. The vaccine doesn't work that way. It does not inject the virus. So people who are immune suppressed may not mount a response at all. And that is really the concern, I think. Additionally, things like fevers and some of the other side effects could be mistaken for some of the treatment side effects of their cancer treatment. And so they really admonish for cancer patients to be careful and have the conversation with their physicians and with their medical oncologists, because those are the people who should be partnering to make that decision.
Thank you. So I'm going to go to Dr. Alexander. Dr. Alexander, I want you to talk about what you tell your patients with a lot of people of color and not of color are affected by diabetes, one of the biggest in our country, and hypertension. What are those risks? What would you tell those types of patients regarding to get the vaccine or not?
So I think I want to first start off with this. COVID, serious adverse events and actual ICU admissions. There's a pretty there are pretty good studies so far that show that vitamin D deficiency is connected to those events.
Absolutely.
That the fatality rate is higher, and that the rate of ICU admission is higher. And as probably, certainly all the doctors here know, 40% of African Americans are vitamin D deficient. And because of that deficiency, their immune response, and this is basically the reason behind it, their immune response is diminished because vitamin D participates in the immune response. So when Dr. Maitland spoke to the fact that the vaccine is an immune booster, you have to have an immune system that is not under assault in order to be able to respond not only to COVID-19 as a disease, but also to the vaccine. So one of the things I am recommending to everyone is that you go to your doctor and get your vitamin D levels checked. And if you are vitamin D deficient, to get it corrected, because it's key to maintaining your health in any case. And it's also a very, very cheap way of keeping yourself healthy. So this is not something that, is well published in terms of people telling you this, but I'm telling you this. This is very important for our community to correct the vitamin D deficiency. And it has other effects, as Dr. Corday will tell us, in terms of your risk for cancer and for other diseases as well. So it's just important to do. So when it comes to this particular vaccine, I happen to be one of the people that did not raise my hand. And I just want to say that I am one of those people that have had an anaphylactic reaction. I literally died almost from eating a mango. My family has a very...
Wait, a mango? What kind of West Indian are you? You're Jamaican.
Exactly. So I was going to say, my family has nut and peanut allergies, very, very severe. My older brother has peanut and nut allergies. My younger brother has had anaphylaxis from nuts, and my son has had anaphylaxis from peanuts. So we have, and this all comes from my mother's side of the family. We have allergies to nuts, peanuts, penicillins. My son is also allergic to penicillin, and my mother was also allergic to all of the cephalosporins as well. So this is a very, and we have asthma and atopic dermatitis or eczema. So we have the whole triad. Dr. Maitland can talk about that. I only have a mango allergy, and I didn't find this out until much later, but mango is a nut. I don't have any nut allergies, thank God, because I eat nuts every day. I'm going to continue unless something happens. But anyway, so I will just say that there are some concerns. I don't know if some of you know, but in some states, they've started drive-through vaccines. And that is of great concern because I don't know how they're monitoring people who may or may not have severe
problematic. Yes, you are right. I'm glad you brought that up.
So, we need to be really concerned because our community does not always get the information they need. And we need to let them know what are the things that they should be concerned about if and when they decide to take the vaccine. One of the things, like I just said, is that I come from a family that there are severe allergies. I would hate for them to go through one of these drive-through vaccine places. They literally go in their car, drive up, they get a shot, and they drive away. I'm like, what is this? Anyway, so you asked the question about hypertension and diabetes.
Yes, and diabetes.
So hypertension and diabetes, guess what? Your immune system has had an assault. Diabetes in particular, your immune system is not the same immune system as everybody else. So I would tell anybody, please, please, please speak with your practitioner, your provider who knows you well to make those decisions when it comes to taking the vaccine. I'm not going to advise anybody to take the vaccine or not take the vaccine. I think that's a personal decision between you and your doctor based on your specific set of circumstances and the issues that you have. But we do know Black people are dying at alarming rates when it comes to COVID-19. We know that we are working in jobs that exposes us at a very high rate to the virus. We also know that we live in situations where we are in multi-generational homes, where we have people that are old, with people that are young, with people that are in very close contact. We cannot necessarily get, away from the people and quarantine and socially isolate the way we might want. And yet those people are coming in and out of the home and being exposed. We also know that we have Black men and women in institutions like correctional institutions and group homes and all of those things, which also increase our risk. So I just say, this is a very important question to ask your doctor. And if you don't,
I fully agree with that. I'm gonna, sorry about that. I'm gonna turf it to Dr. Maitland for a second.
Just to piggyback on the comments of chronic disorders. So period. In this country, 1 out of 2 of us will have a chronic disorder, and more than likely it's going to be cardiovascular. And the issue with COVID, that hyperinflammatory syndrome, that's what's killing people. Part of that are thromboembolic events. So if you have a history like sickle cell or hypertension or diabetes, it's really important to make sure it is under good control. Period. Absolutely. Which means you need a medical home, period. And the decision, just like Dr. Alexander mentioned, it's important for you to have a point person, just like you do, Dr. D. You called me, and I'm like, okay, got it. And so you don't have to reinvent the wheel on explaining your medical course. And then you can then decide Pfizer or Moderna, and then where are you going to get it? And I've told all of my patients, you would get it at a medical center where they have the resources to monitor you, not like a drive-through.
So Dr. Maitland, talking about that, two things. What would you tell now? Because I've had, I guess these are chronic diseases as well that affect people of color. The sickle cell patient, that's a big one. And also the autoimmune patient, someone who has rheumatoid arthritis, Sjogren's, lupus. Those are big, especially amongst women. What are their risks? Should they take the vaccine? What are their risks with COVID if they contract it?
So I have to tell you, that's rather controversial at this point in time. I can tell you for the people that have mast cell disorders, there's not been an increased risk. We've had from the Mastocytosis Society, we have thousands of patients, and there have been 30 reported COVID infections, and they were either asymptomatic or mild. And if you think about what is killing people, it's an overactive immune response. So in many ways, if your immune system is already distracted by other immune disorders, it's kind of like asking your fire department to break away from the one fire that it's inappropriately at and then go to another inappropriate fire. And that doesn't seem to happen. That being said, I think it's really important, like the number one thing that's been shown to reduce the development of COVID actually is nasal saline or a warm sinus steamer. Keep your nose and sinuses clear. Everybody talks about.
For 1 second, because I know my mom is smiling because she has probably bought us all the steamer. So yes, Mom, if you're watching, we give you credit. Yes, that was right about the steamer.
Right. I mean, I granted masks are great for hand washing, but this is a respiratory pathogen. And like I said, it sits up there for 5 to 19 days. So don't give it a chance to set up shop and become a squatter. Wash it out.
Sounds fantastic. The next question that I want to ask going forward, I'll comment, for the podiatry perspective. So we see patients that, no one really noticed they were having these toes, particularly you see it more visible, obviously, on lighter skinned individuals, correct? And they were seeing these purplish looking toes that look like bruises, or maybe it was some type of purpura, which is a skin condition. Is it a dermatitis? And these patients had what they're calling COVID toes, which were vascular assaults on the extremities and the digits in your fingers and toes. And they were positive. And you think, as many as young people do, that's not me because I'm 20, but they were happening a lot in the 20s and 30s and 40s. And these patients were coming in. And if they couldn't mount a response against it, then they were having vascular assaults, which means that they were throwing clots literally in their extremities, which led them to the operating room, and we were amputating. And this is not happening on old folks, as people may think. It's happening on a young population. And so that is what the podiatry community and orthopedic community was seeing. Like, it manifests in all organ systems. Why COVID is so important.
Right.
So with me saying that, my next question is to all of you. Let's talk about, and people are, have been booed up, as the word is, and having babies. So now you have a population of women having pregnancies and having babies during this. And I've had a friend of mine who I punted to my OBGYN friend, Dr. Nicola Pemberton, should I get the vaccine or should I not if I am pregnant? And should I get the vaccine or should I not if I'm breastfeeding? So whoever would like to take that, I would love to hear your response.
I would have to say that there's been no reservation at this point in time in administering the vaccine to either breastfeeding mothers or women that, how many women they're like pleasantly surprised that I'm pregnant. So at this point in time, there's been I've not seen any data suggesting that women should not be vaccinated.
I can't say that I've seen any either, and the society has come together and produced a consensus statement, and they're endorsing it as well for women who are pregnant and also for those who are family planning. And I think that had been a bit controversial previously, but they are recommending.
Okay. And next question that I have. So, of course, first responder, all of us are considered essential workers. And, we're seeing in the news, they've been publicizing it so much that a lot of first responders who are actively working, some of them are not taking this virus, vaccination, because of some of the things that we're previously saying. And so if you have a first responder, or essential worker, that could be anyone who is a doctor to a nurse to someone who has to firefighter, EMT, whatever, janitor. What would you tell those people who maybe have reservations or they're at increased risk, even if they say, well, I'm not directly dealing with patients, I might just work for a hospital or I might just be cleaning the area. What would you tell patients like that, particularly people who live with other, as you said, some of us are very multi-generational, mom and dad and grandma at home. Dr. Gary, what would you say? Can't hear you, Dr. Gary.
I think it's important, as I believe both of these doctors said, is to really reinforce the importance of boosting your immune system and trying to do so naturally. I think it's important for these essential workers and first responders, as it were, to form that relationship with their doctors and maybe get some blood work prior to getting the vaccine, because one of my concerns and questions actually for this group as well and for those watching is that as we talk about people who have undiagnosed chronic illness, right? Undiagnosed, that includes much of our community, and if there is a relative contraindication, I guess, for those people because of their immune status, what does that mean for us as a group and our ability to gain immunity and also our fitness for this vaccine? So a lot of questions there, but I think forming that relationship with their provider, getting blood work and working to boost their immune system naturally are all great ways to augment and prepare themselves if they would choose to get the vaccine. But if they are adamant about not getting it, I would encourage them to think of their reasons why and have a great conversation with their doctor.
Dr. Alexander?
Okay, can you hear me?
Yes, I can.
Okay, good. So I'm in total agreement with Dr. Gary. I would tell you, first of all, I recommend that everyone boost their immune system naturally, and that means a good, healthy diet that is mostly plant-based, to get some exercise, preferably in the sun, to mask up, to back up, and to walk up. And I want to just say that the vaccine is not a panacea, because we do know that the vaccine, they did not test whether or not people still remain contagious after getting the vaccine. So even those people who get the vaccine potentially could pass on the virus to other people. So I would, and I understand people's, reluctance because, as I said, this is brand new. It is still in its experimental stage. So if they want to wait, and there are some concerns about waiting, I would tell them to discuss it with their provider and make that decision based upon that.
Dr. Maitland?
I guess my greatest concern is that a lot, not only do I diagnose people with hypersensitivity disorders, for instance, even if you have the diagnosis of asthma, more than likely you're not well controlled. And so this all again falls back to having a medical home. And we've been fortunate that we're educated enough to know who is willing and able to take care of us. And I find that a lot of people in our community, that is not the case. And we need to kind of give them the tools to figure out how to build that medical home, no matter what. And shows like this is exactly the way we can, put information forth. So I think I think with the new administration coming in, the ability to have a choice on a vaccine is probably going to be of a different dialogue. So I think people will have that choice now, but at some point in time, that's not going to be a choice. It's no different than children who have to go. In order to go to school, our kids had to have vaccinations. Take a look at the measles epidemic that killed people. So, and I think what we're talking about again is one person is dying every 30 seconds. So we have to intervene some way. It's not a panacea, but in some ways we need to change how our bodies see this virus, because what's happening now is not a bright future.
Fantastic. My next question, hold on, ladies, let's get you going. And I'm going to start I know people are like, how can we find these fabulous doctors? I'm going to be putting their information that will be running across your screen so you can contact them. Dr. Michelle Alexander is in New York City. Dr. Ann Maitland is in Westchester. Dr. Monique Gary is in Sellersville, Pennsylvania. South Jersey folks can easily find her. North Jersey folks can easily find her. And I'll be running their information. So I'm going to talk about one more thing that I'd like to, as we start wrapping up slowly. So, okay, we have the vaccine. People want to know, hey, is this going to be a hot girl summer? And I've heard, people are traveling right now and could care less. The airports we've seen have been insane. People visiting their mama, their cousin, this one, that one, which I understand that we're social by nature, but at the same time, we need to protect others. So now people get the vaccine and they're saying we're going to have the big picnic this summer, fest, whatever the case may be. Who's flying to the Caribbean? What would you say to those people in terms of getting their life back? As people keep saying, my life has been on hold, I can't take it anymore, and I'm ready to be social. I'm going to put that first one to Dr. Gary, whose face is popping me up.
I'm feeling it. Absolutely. You saw my hashtag when I got this vaccine. Hashtag I did it because I want to travel again. And I think that we have to really caution people to be careful. Be careful for themselves, for their family, for their loved ones, for their communities, for their patients. So, I've been quarantining quite a bit, even through the holidays, everything that we should do. One, because I don't want to bring something to my family, but two, because I work with a vulnerable patient population and I want to be sensitive to them. And I think that as outside begins to open back up, this concept of herd immunity, meaning the majority of the population having some immunity to the virus or to the pathogen, is based upon about a 70% uptake. And we're nowhere near those numbers. So we need a larger portion of the population to even accept this vaccine before we could all expect to have such a level of immunity that the average persons among us would not get sick, and we could protect those who were the most vulnerable, because that's really what that concept of herd immunity stands for and does. So be careful. Do not go out without your mask. Continue to social distance, especially in places where there is, refreshed and closed air, like airplanes. The majority of the places where people have contracted the virus had been in the lavatories. because they took their mask off in there.
Absolutely.
So
Absolutely.
we got to be careful.
And just think about what's going on in the airlines right now. They're not even mandating. They're not mandating screening, getting onto the plane. They're not mandating people wearing masks. There've been several incidents, and think about the people that work on the airlines. They've been exposed to people who absolutely insist on taking off their masks and being on the plane. And there's been no teeth. There's been no teeth on the federal level to protect our essential workers. Nowhere.
Absolutely.
And so I would hesitate back, because if I don't know about you, but I've already lost 3 friends to COVID, and it only takes one encounter where you're careless, and I can't tell you if people are wearing masks, it's right here. So
Under the nose, which aggravates me to no end.
right, and so as much as I care for my neighbor, I need to trust that they're going to do the right thing. And until the discourse changes in this country, I trust who I trust, right? And I think it's important to know that even the most well-meaning family members or neighbors might not necessarily be doing the right thing by themselves, which means they can end up causing a problem with anybody else that they come into contact with.
Absolutely. Dr. Alexander?
So based on the current distribution of vaccine, they say that it will take approximately 3 years to gain herd immunity. So, and that still means that while we are doing that, we still will have to wear masks, we'll still have to social distance, and we'll still have to continually wash our hands or sanitize ourselves. So that's the current projected time that it's going to take. I think you know, Corday, that I recently did travel, and I traveled to Florida to see my dad, who is in a very vulnerable age. He is 92 years old. Thank God he's healthy. Thank God my stepmother, who I won't tell her age because she would kill me, but she's younger than my dad. But she's still in a vulnerable population. So when I went to visit him, I traveled on a plane. The plane turned out to be extremely crowded. I did not expect that, but I did go appropriately dressed. I had on a complete Tyvek suit.
So for those who don't know what that is, she was dressed like Naomi Campbell. If anybody knows the model, she's been doing this prior to COVID because she is a germaphobe. Michelle followed in suit and was quite prepared.
I had the suit on with a face shield and my mask. So I was not playing. And when I got to my parents' house, I took off everything, and I did not come into the house with any of the things that I had traveled with. And I left the suitcase out in the garage so that I could sanitize it and everything before I brought it in. And thank God my parents happened to live in a very large home where I had my own space in terms of bedroom, living room, and kitchen. So I did not share any of those things with them. And during the time that I was with them, I wore my mask at all times, and so did they. So even though I saw them, I was not exposing them. And I know I don't want to go on very long, but I want to just say that I told my parents to mask up from before February of last year. So they've been masking up for almost a year now.
And so with that being said, I mean, with my family, my parents are vivacious people in their 70s. Hopefully nobody will get mad at me for that. And my mom's a retired ER/ICU nurse. So my mom is quite savvy on what to do and what not to do. And she probably knows more than all of us because she's retired. So she's watching and reading the information. Like, you know, I'm like, okay, Mom, I guess I can. And so even visiting them, I really don't go in their house. I'm usually at the garage door or the entrance door. I sit on a little bench with my mask on. They're on their mask on, 6 feet away. We're not touching. We've elbow bumped. We've given the Wakanda symbol. I think we are just, being very enterprising. And I've been, part one of the vaccination. So as we're coming slowly to a close, I want to ask about children because kids are going back to school. some kids are children are in situations where they're doing that remote learning, and every parent, I feel for you, and that new math and how to teach French and God knows what else. And there are children who are going back to school because they don't have options. So my question is, and I'm going to give that to Dr. Maitland, for children going back to school, my niece and nephew are going to be returning in January. Their school's a private school where they do extensive testing 2 weeks prior, and they have to isolate and they get the swab the same day that usually a public school just financially cannot keep up with. What recommendations would you give for parents and grandparents and other caregivers? And you're on mute.
Thank you. Sorry, I didn't want to have background. I have to tell you, I'm recommending the same thing. If parents have the resources to allow their child to go back to school, I encourage it. I have to tell you, we've already had 3 kids test positive who come into my office for allergy shots. And the ramifications of that is that I had to shut my office down for a couple of days. And then the parents have to go through extraordinary, efforts in order to make sure that no one else contracts that. So if the resources are able to do to stay home, then I'm probably encouraging that. But again, the underrepresented communities of color don't necessarily have those resources to stay home. And actually, a lot of them depend on the meals that are provided at the schools and the structure that's provided at the schools. So at this point in time, we're kind of, it's a really tailored response. It's a really tailored effort. I mean, that is a conversation between the parents and the pediatrician and the child to see whether or not they're able to do that. It's a new world order, and I think we just need to understand, until we're in a better footing on keeping this virus under control. And by the way, although children are not infected, or they're infected but not affected by COVID, we do still have these rare cases of a Kawasaki's-like disease. So I think, again, it's also very important to be mindful that this virus can hurt us in lots of different ways, and it's really, really important that we make efforts to protect ourselves. And I agree with Dr. Alexander: nutrition, exercise, nasal saline, just like you brush your teeth at night, wash out your nose at night. I definitely am a big believer in probiotics and vitamins as tolerated, because not everybody does well with those. But again, this goes back to, again, having a conversation with a practitioner who knows you and your family.
I'm going to jump in here. Can I jump in and say also that I think it's really important for parents to have to be involved with the school district and what's happening at the decision-making level for our schools, because what good is sending your child back to a school where the classroom is already overcrowded and there's no social distancing. And I think that we have to look at that and hold these schools accountable to the best that we can, and make sure that there's advocacy and start to get a little bit more involved in some of the activism around our health, because this is a great opportunity to see how it interplays with everything else, not just what happens in the hospitals, but what happens in our schools and what happens in our daycares, what happens for us in our homes as well. So I think this is a great sort of clarion call to people to get involved in the activism around health.
I'm going to ask Dr. Alexander, as Dr. Alexander, you were the former director for CONED, where you dealt with people who, as we mentioned, that have to come to work. What would you say to them? If they're going to work, that means their children are going to school. So can you comment on that as well?
So adults that are going to work, I think that, you have to, first of all, decide whether or not you can go to work, because there is a such thing as the Family Medical Leave Act. So if you are particularly vulnerable, you might be able to work with your job in terms of obtaining appropriate clearance, and this is, of course, with your doctor, in the case where you might be in a position where you are being exposed. So that's something, just as an aside, I just have to say that, because not everybody, even though you might have to go to work, not everybody has to go to work. And if you can arrange to do distance, if they can put you in a different position, if they can put you in a position where you can, you're not necessarily that you can, work from home, then that's something that you should also be talking over with your job. But for those people that must go to work, bus operators, train operators, grocery store clerks, that type of thing, this is where, really getting your immune system in order is key. And, it's the tried and true things that, our grandmothers have said, you have to drink enough water. They say you're supposed to drink half your body weight in water every day. You need to get enough sleep. Excuse me?
I said, I'm working on it.
Okay. I'm working on it all the time. I actually have to add, lemon and other things to my water in order to give it some kind of taste. So, but water is key because that, first of all, it helps flush everything out. And by the way, the dentist also said that if they were in on this early, they would have also told you that gargling and clearing your airway in terms of the things that come into your, your airway and your mouth are also key to prevent you from getting COVID. So water, sleep, healthy diet, and exercise. Those things are very, very key. And then you have to do something to reduce your stress. We are people that love to be with other people, tend to love, we like to hug, we like to touch. So this is really driving a lot of us insane. And I would say, especially for our elderly population who may not be in touch electronically with everything, they're being very, very isolated. So I also tell people, reach out to those older neighbors, those other people, just so that they can see that they are in touch with people. I also will tell you that testing is also key. I recommend that you really speak to your doctor about the type of testing that you might want to get, because the earlier you get tested, the earlier that they can address these. I don't know, a lot of people, we haven't talked about some of the other treatments that are available for COVID-19, like convalescent serum. We need to talk about that because that has also been very effective. And the earlier you get it in the course, the better off you are. And so therefore getting tested is key. And you also know that, the type of test, there are different types of tests. There's a nasal swab and there's an oral test. The oral tests have now been, they've gotten FDA approval. So you don't necessarily have to have the nasal swab done. And as long as the test is sensitive and also correct, then you can do that as well. So those are the things I would say. And and also just to mention what Dr. Maitland has already said about the nasal, using the nasal steam, very, very key.
Very important. So as we come to a close, I want to thank everybody for just who are on, people who will watch this later. This is a very important topic. It affects white, Black, Asian. This virus does not discriminate. I would love you to come on and like my YouTube channel and subscribe to KD Styling. This is Talk with Dr. D that you find on YouTube. My information is running across the bottom. So please like and subscribe. I'm on Instagram at Styling by KD. I'm on Facebook at KD Styling and on YouTube at Talks with Dr. D that you see. So in closing, I'm going to hit each one of these wonderful women. I want you to stay on after the broadcast ends. I would like, we'll start with Dr. Monique Gary. Just one closing statement and how we can find you also on your social media. You're on mute. Let me unmute you.
Sorry about that. I said I was having trouble hearing you, but I think you said, how can people find me on social media?
How can people find you on social media, and one closing statement?
Wow. One closing statement is that, in no place better than cancer clinical trials. We see the effects of what happens when we don't participate in trials and when we are not active participants in our health, and with good reason, yes, and all of the historical context that goes along with it. But I think that this moment is a wonderful opportunity for all of us to get engaged in what's happening in our communities, in our health, in our homes, in our bodies. Ask questions, and find clinicians who will answer those questions. The ones that affect your family, but the ones that are unique to you and to your health. Be really involved in that process, and make an informed decision before you hear and believe everything on the internet. Know that there's some truth that is out there, and there's some good advice, and you can find that advice by talking to your doctors. I can be reached on all social media outlets: Facebook, LinkedIn, Twitter, Instagram, YouTube channel at Dr. Monique Gary, and Wednesday nights at 6 p.m. Eastern Standard Time on blackdoctor.org, for the doctor is in. So thank you, Dr. Cordi, for having me. I'm so thankful to be here.
Thank you so much. All right. Dr. Michelle Alexander, closing statement and where we can find you on social media.
So I will tell you that I always think it's important to find a doctor that knows you as a Black person. And not all doctors know Black people. So I think sometimes it's best to find a Black doctor. Can't find a Black doctor, find a doctor who knows Black people. I think it's critical to our overall health. I can be found on Twitter at MDAMD, and on IG at SunkistMD, and on Facebook and LinkedIn under my name, Michelle Alexander.
Thank you so much. Last but not least, and then I will close with my comments, Dr. Ann Maitland.
So I think we all need to think about healthcare as a consumer business. And like Cy Sims used to say, an educated consumer is my best customer. So it's important that you get the right information. Dr. Google isn't necessarily it, but there's great information on National Medical Association, blackdoctors.org, the Empire Medical Association. I can be reached on Twitter at Ask the Allergist, and I'm also on LinkedIn as well as Dr. Ann Maitland. I'm happy to address questions, and on my website, drmaitland.net, or drannmaitland.net, you're able to reach out, and I'm happy to provide any information that I can. I think it's just really, really important, especially in this time when we're finally recognizing the fact that faces of color have not been treated well by our country. And now this is the time where we can actually make meaningful action. If we can flip Georgia, we can flip anywhere else. So peace and blessings.
This was wonderful. So I guess I'm the one to give the closing remarks. How do you find me? So my name is Dr. Cordi Decoto. I'm a board certified podiatrist practicing in Northern Jersey with the Heart Center of the Oranges. And my information, even though I have it more so for my practice, for this, is that you can find me at orangeheartcenter.net. This was something that was a labor of love. I definitely invite these wonderful women to come back, because the information for COVID and vaccinations and all the things that I'm asking is constantly in flux. It's changing. Articles come out every day. A lot of people, the first responders are all getting, the most part, getting their vaccinations, and then the very high-risk patients are next. So we will definitely have everyone, hopefully these women will do it for me, coming back to do a follow-up of what has transpired since and what new information is out. We aren't going to have any more for the month of January, as I bet and changed some great things for Katie Styling and Talks with Dr. D, where we are coming back strong for Pink Goes Red, which is Heart Health Month for women, starting the first week of February, and we'll be going forward and quite heavy the month of March, which is Women's Health Month. Again, if there's any questions, feel free to find me at my social media, which was running across your page, which I will run again for everyone. And with that, I'm going to check to see if we have any last minute questions. think everybody has pretty much said that you answer their questions. Some of you are their doctors. Spread the word. This is recorded to my YouTube channel. We would love this to be something that becomes national. You know, I think big. I don't think small. Spread the word. If you're connected to people, spread the word. And we're going to keep fighting the good fight every day. Educate while entertaining our community. My name is Dr. Cordai Decoto, known as Dr. D for Talks with Dr. D. Thank you. Ladies, stay on. Everybody wave. Thank you, everybody. We appreciate you. And have a
Thank you,
blessed
Dr.
weekend.